implemented the Urgent Community Response Service. This is a service that was launched on the 4th of October, and the real focus is being able to see patients at home that previously would have been taken to an ED or to the acute hospital. And what we believe is if we can see that patient at home within that 2-hour period, we can look at what's happened to that patient, put in an immediate assessment, look at the home environment, and then hopefully put in a plan of care and some services that will support that patient to stay at home. What we believe happens sometimes is frail elderly patients, if they have a fall, if they become unwell, are taken to hospital via ambulance and may have a long assessment within an urgent emergency care department. And actually we can provide that care at home for that patient. That will avoid them going to hospital. It avoids patients spending long times in A&E departments, but also most importantly, it makes sure that that patient maintains their independence and rehabilitation in their home environment where they're much more comfortable and confident.
So often as a GP, I see patients either in the surgery or at home who have suddenly become more unwell. They're often older, frail people. And sometimes we feel like the only option to keep them safe is to admit them to hospital. But we know that if we could care for them at home, if they could get the extra support that they needed, that we can often treat them at home and allow them to get better at home. The urgent community response allows us to do that. Having done an assessment by referring to the urgent community response service, an assessment will be made by a multidisciplinary team to see what care is needed to keep that person at home. It might be an elderly lady who has had a fall and needs some help to recover from that. It might be an elderly man who's got a urine infection and you're happy to treat that infection at home, but he's more confused than he normally is, and that means that he needs some extra help whilst he's getting better.
So the service operates 8 till 8, Monday to Sundays, 365 days a year. The cut-off for referrals is 6:30 p.m. As soon as we've received the referral, then one of our members of staff that's triaging for the day triages the referral. They'll contact the referrer after having looked in the notes. One of the ways that referrers can help us is by providing a contact number so that we can ring them back really quickly. We don't always have to visit the patient. There are things that we can do to keep them at home, maybe video calls, something that can be sorted over the phone.
Our patients often tell us that they would prefer to stay at home. It's where the place that they know, it's where their family can see them, it's where they feel safe. So anything that we can do to try and keep people at home and treat them at home if possible is going to be better for our patients.